everyone. So now we are going to look at inflammation. Inflammation is a process in which inflammatory cells, plasma protein, complement system, and fluid exist the blood vessel and enter into the interstitial spaces of the body. That process is known as inflammation. And there are two types of inflammation. One is acute inflammation and another one is chronic inflammation. Now, acute inflammation is characterized by presence of edema and neutrophils in the tissues, and chronic inflammation. Okay, so mediators of acute inflammation are number one, tool-like receptors. These are receptors which are present on the cells on innate immunity. These are mediators of acute inflammation, tool-like receptor. Another mediators are arachidonic acid metabolites, and the third one mediators are mast cells, and other includes complement cells. Complementary system is also mediators of acute inflammation. Now here you can see, and the last one is Hegman factor, like factor 12 is also mediator of acute inflammation. These mediate the inflammatory process. Now we will be looking at the cardinal signs of inflammation, means what signs are present during inflammation. First of all, redness will be there, warmth will be there, redness, swelling, or it is also known as tumor, rubor, tumor, dolor, and fever. So redness, swelling, pain will be there because of bradykinin and prostaglandin E2, swelling due to leakage of fluid, redness due to vasodilation, and excessive blood flow in the cutaneous vasodilation. And the last one will be fever. Last one will be last cardinal sign of the inflammation will be fever. Fever will be because of interleukin 1 and tumor necrotic factor. Interleukin 1 tumor necrotic factor increase prostaglandin E2, raises temperature set point and results into the fever. These are cardinal signs of inflammation. Now, what happens? First of all, neutrophils come, margination happens. They neutrophils roll over the endothelium, rolling happens, and then adhesion with the endothelium with the help of ICAM and VCAM receptors, and then integrins up. Leukocyte adhesion results into the transmigration or chemotaxis of neutrophils out of vessels, and then migration, and last one is the phagocytosis. Phagocytosis causes eating up of the bacterial toxins by the neutrophils. Now, having said that, after inflammation, there are some diseases that are related to these receptors and the immune system. Primary immunodeficiency disorders. First one is Digeorge syndrome, occurs in development failure of third and fourth pharyngeal pouch. It is also known as 22q11 microdeletion, present with a T cell deficiency because patient has lack of thymus. It results into hypocalcemia, lack of parathyroid along with lack of thymus, and then abnormalities like heart and great vessels and face abnormality will be there. This one is known as Digeorge syndrome. 22q11 microdeletion. This one is the high yield, so you have to memorize this 22q11 deficiency Digeorge syndrome. Another is combined immunodeficiency syndrome, SCID. It is defective cell mediated and humoral immunity, and cytokine receptors are defective, and also there is adenosine deaminase deficiency will be there. MHC class 2 deficiency results into the activation results into the susceptibility to the fungal, viral, and bacterial protozoal infections along with opportunistic infections, and the treatment is sterile isolation. Bubble baby will be there, and stem cell transplantation treatment is there for severe combined immunodeficiency syndrome. Another one is X-linked A-gamma globulinemia, in which complete lack of immunoglobulins due to mutation of gluten, tyrosine kinase, X-linked recessive disease, and a vaccine may be avoided like polio vaccine. So these are some uh, the immunodeficiency syndromes associated with this